So good afternoon, everyone. For those, welcome to our March edition of the Digital Dispatches. My name is Suhan. I am the Innovation and Digital Ecosystem Lead for Digital Health and Care Northern Ireland. And today's dispatches, Digital Dispatches, we're going to be talking about something that has actually been used in Northern Ireland for quite a while, which is the HSC&I Apps Library. And with me today is Alison Johnson from ORCHA Health. Alison is the head of the UK Health for ORCHA, and she has been instrumental in supporting us to get some of the work that we've been progressing during the year and in the previous years as well on the HSC&I Apps Library. So a bit of housekeeping. First of all, the session, as you will be aware if you've attended previous sessions, will be recorded and it will be subtitled and published on DHSCNI TV, YouTube, so that if there are any colleagues who are unable to join or for people who want to rewatch, please subscribe to the DHSCNI channel on YouTube. Could I also ask everyone to put your mute button on so that we don't get any disruptions with background noises? And if you have any questions, please feel free to put them in the chat, even as Alison is presenting. They'll be picked up at the end. They'll be picked up at the end, if not already answered. If not, we'll then try and answer during the chat itself. So if you have any other questions, put your hand up now, or else we'll start the actual session. So before I hand over to Alison. No. So, okay. So over to you, Alison. You're going to share your screen.
I am, and good afternoon, everybody, and thank you for joining the Digital Dispatches and for the kind introduction to attend today as well. So what I'm going to do for the next 20 minutes is just talk a little bit about ORCHA and the work we do, but more importantly, the work that we've been doing, working with DHSCNI across Northern Ireland to kind of really push out the app library and the formulary as well. So I'm going to start with a little bit of an introduction to myself. My name's Alison. I'm the UK Health Lead with ORCHA. I've been with ORCHA for about 3 years, but prior to that, I kind of led a couple of national digital rollouts through NHS England, and I've got a long background in kind of transformation in healthcare services as well. A little bit about ORCHA and the work we're going to talk about today. So ORCHA stands for the Organisation of the Review of Care and Health Apps. It's been kind of established for around about 9 years. And the essence of what we do is to take the kind of wide range of apps that are available from a health and care perspective, and we assure those apps to make sure that they're clinically safe to be used. That isn't the end point, because for us, our mission is to make sure that those apps then get into the hands of the public. And we've got 2 routes to do that. And I'll talk a little bit about that today through the app library and also through the formulary. But I'm just going to get started with my slides. So let's just look at the digital opportunity. And I guess, you know, obviously from a Digital Dispatches, I'm imagining that a lot of people on the call today are involved, have some kind of involvement with digital on a daily basis. And the area that we're focusing on is around patient engagement and empowerment. So in this hexagon diagram around all of the things that are currently taking place, I know that there's a big programme going on across Northern Ireland, the My Encompass programme, which is really exciting about the electronic patient record and providing more seamless care and making it, you know, data more timely for healthcare professionals. But today we're focused on the patient engagement and empowerment. So how do we make sure that patients have access to a wide suite of products that can really help them with their self-care and self-management on a 24/7 basis, and just take away some of those barriers that exist sometimes for patients when trying to access care. So if I then move in to kind of the world of ORCHA and what we do and the challenge that we find. Couple of statistics. There are over 365,000 digital app products that are available in the health and care space. And from the work that we've done at ORCHA, we've assessed over 28,000 of those, and we find that less than 20% of them meet the standards that you would expect. Now, when we assess product, we look at it through 3 specific domains. So the first thing we're looking at is data and security. So making sure that the data within that product is being held safely, information isn't being passed over to third-party providers, and it's meeting all of the Cyber Essentials data that you would expect, and DB and ISO standards too. The second thing we look at is clinical efficacy. So making sure that from a professional assurance perspective, that health or care product has been designed by healthcare professionals that work in that field, that there is a research base that sits behind the product, and it's gone through a study as well, whether that's a randomized control trial or whether that's a kind of more localized study with a group of patients to test it and to test the assumptions that that app is making. And then the third and final domain is around user experience and accessibility. So again, just making sure that all the ISO standards, the DB standards are met within the accessibility framework. What we then do is we take a product through assessment, and if it meets those 3 domains and scores well, over 65% across the 3 domains, we'll then publish it onto our library or our formulary. So anybody that's coming to the ORCHA site knows that a product that they're choosing has been assessed. It's gone through an assurance process. It meets the standards that you'd expect, and it's safe for use. It's clinically safe. But the challenge remains around trust. So, you know, I've been working with Sue and the team for quite a while, and there's something about, you know, people want to be able to look at those apps, choose them for themselves, and quite often the governance stands in the way of that. And the publication of the library just provides a step that we've actually taken that assurance on your behalf. So you know that any product that you're reviewing on the library has gone through that mechanism. The second thing is around awareness, and again, through the work with Sue and the number of clinical teams that we've talked to, quite often there is a lack of awareness around the range of products that are available to support in this space, but also around things like clinical reference tools in that space as well. So we work with a lot of clinical teams who for the first time are really starting to think about the use of apps within their care setting that can be passed on to patients. Distribution is also a problem too, and again, that's why we've got the library and the formulary. It's one space where you can go to and either choose an app or recommend an app. And then reimbursement is a challenge for anyone that's familiar with Sleepio. It went through NICE processes 18 months ago and was deemed to be safe to be, you know, a plan was put in place for that to be commissionable right across the UK, and it just hasn't happened. The funding isn't there. So reimbursement remains a problem, and that's something, again, that ORCHA, we can help with commissionable apps and how they are surfaced. The final thing is around governance. So any product that's on the library isn't just assessed once, it's continually reassessed. So just in the same way as your phone will go through an upgrade, an app will too, and we reassess at that point. If an app hasn't had an upgrade in a 12-month period, we'll write out to the developer again, we put a red flag on it, and if we've not received an update by 18 months, we'll remove it from the app library. So the products that you're seeing are constantly being re-reviewed and are the latest version of the app. So again, making sure that from a safety perspective, we're keeping our clients, such as yourselves, safe, but also the public safe too. So it starts with trust, and I just wanted to very quickly give you an overview of some of the work that we do at ORCHA, and you can see then how HSC&I sits kind of within that. So we have what we call the global baseline review, which is our assessment process, which I've just described with the 3 domains, and that's in the pink boxes here that I'm showing you on this table. And then above that are what we call enhanced reviews, which is where globally we've created assessment frameworks for different governments. So we've worked with the US with the Digital Health Assessment Framework. We're working with the Mental Health Commission in Canada. We've worked across the Nordics, New Zealand, more locally with the NHS DTAC, and also the latest ISO 82304, which is the European label to enable scheme that came into being in summer last year. So all of these elements provide what we call an enhanced layer. They're all slightly different. I guess the commonality across all of them is the ORCHA baseline review. Every single one of them has those elements in it. And you can, again, I've described the kind of 3 domains around data privacy, professional assurance and usability, but I'm absolutely rubbish at remembering all the different ISOs, but it has them here. So in terms of the standards that we're working to, just so you can see them. So how do we then get those apps out into the hands of the public? And I guess this is where the work, working with yourselves in Northern Ireland really starts to take focus. And my remit is actually supporting our clients across the UK with different strategies of how we get those apps out into the hands of the public. And we've got 2 routes to do this. So the first is the direct to patient route, and this is through the library. And I will show you a version of the library in a second, just so you can see that. Within that library, any member of the public can come to the library and look for an app themselves. There's a search button on there, but it also enables us to produce targeted pages or campaigns where we can work with very specific members and cohorts of the population. So the focus across Northern Ireland is very much around mental health. This year we've produced an adult mental health campaign that creates a whole set of apps that are suitable for treating low-level anxiety and depression. Any member of the public can come direct to the library and find an app for themselves, but we've also got a campaign that we can push out. The second route is professionally supported, and this is through what we call our Formulary. So the Formulary is a lockdown platform. So every healthcare professional gets given a password so they can enter their own, and they have their own dashboard. This enables healthcare professionals to directly recommend apps to patients. And so we've been working with a couple of clinical services this year. We've been working with the school nurses to support children as they transition from primary into secondary school, so the year 8 population, with a whole range of apps that can support them as they go through that stage. And more recently, we've started conversations with the adult psychological therapy services around a set of apps that they will be able to use, and we're just in the process of shortlisting the apps for those. The key difference is if a patient goes direct to the library, what we tend to find is that probably about 20% of the population will go on and download a product. That changes if an app is professionally supported by a healthcare professional, so it's recommended out to a patient. Up to 70% of the population will go on and download that app because they see it as coming from a trusted source, it's coming from a clinician, and the information that's produced on the back of that recommendation actually tells the patient that they're being recommended an app from the service of HSCNI. So it's a very safe route, and we know that that has far greater uptake in terms of the product being downloaded. So this is just a little bit more about the libraries, and at this point what I'm going to do is just switch my screen so I can actually show you a demonstration of the library. I think that helps bring it to life a little bit. Just checking that I'm doing okay for time as well, so just bear with me a second. So this is your library. Hopefully the logo will be very familiar to you and the imagery, and I'm just going to show you a couple of features on the library. So let's just start with, if this is obviously the population library, so it's available to members of the public to find, and I'm just going to come along and I'm going to look for an asthma app. So it immediately brings up 27 searches for me, and what I've then got the opportunity to do is to filter. So I'm going to filter by cost because I'm going to say that I want a free app. And again, you can see that that range has dropped to 18. I'm then going to just show you an app card. So let me just choose. So I'm going to look at Digital Health Passport. This is a really kind of popular app used effectively across the UK for managing asthma and COPD. And if I click on this app card, I immediately start to see the score. So going back to that assessment that we talked about, it shows me the score of this app. So this app is a high scoring app. It scores averagely 88% across iOS and Android. And I can see that this is what we would call a level 2 app. So we grade our apps from levels 1 to 4. A level 1 app might be something like a wellbeing app, something like Strava that many of you on the call may use, helps you manage your activity. It's not recording personal data. That data flow isn't being pushed back to a different source. So it's just something for you to use. A level 2 would be a general health app. So within this app, if I click into it, all of the app cards will give you a description of the audience, who it's kind of suitable for use by, and a little bit about the app. So a level 2 app would be things that has general advice for me. So in this particular instance, I can keep my own diary, but the data flow isn't going anywhere else. It's still my own data. It gives me information around weather, so to support any exacerbations around asthma, and it has general advice on it as well. I'm going to scroll down this app and just again show you the scores. So we talked before about the 3 domains, and anything over 65% is published on the library. As I said, this has a score of 88%. But I can also then get into the detail of the assessment process that's been used to create that score. So I can see from a data perspective, the standards that are being met, that it's compliant. From a professional assurance perspective, I can go in. I also get a really nice gallery of the app itself and some of the imagery within that, and I get the usability score as well. Any areas that are in red have been highlighted back to the developer of areas that they could continue to improve. So this is a really good level 2 app. If I was coming to the site and I wanted to download it, I can literally click on the blue button and it will take me to the appropriate store for me to go on and download that product. Other features of this library, and this is where we've really started to see a kind of difference and an uptake in activity across Northern Ireland, is where we've run what we call a campaign or a landing page. And I've mentioned the adult mental health one. So if I just click into this is a live campaign. Again, what I'll do is put chat, kind of put the links into chat. So I'd encourage everybody to go away, have a look at it, share it with colleagues as well. But this campaign has a small selection of apps that are suitable for low-level depression and anxiety. So we have a couple of apps around anxiety. We've taken all of the apps within this campaign are free. We've taken really high scoring apps, and we've taken apps that are really popular in use across the UK. We also cover low-level depression on here. So we've got Weiser and Headspace and Distract. And then if you're feeling stressed, we've got some apps here that can support, and we've got sleep hygiene and general well-being. You'll also see that we've got the Find Help NI app that's in here, so a locally grown app, and we have tried to encourage the use of those apps for the population as and where we can. So again, we've got your own app within there, and we've got medication reminders. So these campaigns have a slightly different URL to the library, which means that we can push them out through e-coms routes. So we can take that URL, it could go and waiting kind of list letters. It can be used in any patient communications. You could even create QR codes to go on screens in areas for people to receive this information. And this campaign launched back in October as part of the NICON conference, and I'll show you some of the data. I talked as well about the Year 8 campaign, and again we've got a link to that here. And then we've got a range of carousels that have been really carefully curated with apps, so that any user can come and search for something themselves using the kind of these carousel images here. So that's the library and the campaigns. I also very quickly want to talk about the Pro account. The Pro account is the locked-in space. Anybody can have access to a license. And again, if you'd like to hear more, then please contact either Sue and we can arrange to have a chat. But similarly, to the library, this has the same apps, it has the same search terms. The key difference is here we can create a set of apps for a clinical service to use. So because this is a locked-in site for healthcare professionals, for the school nurses, we actually trained over 100 school nurses in January in the use of the formulary and the apps associated within their area. So the school nurses can come directly to this area. They don't need to search for the apps. They can come to their own area and they've got all of the apps that have been agreed to be used within this service to support the Year 8s. We've got a whole host of apps in here that cover everything from resilience, setting goals, building new friendships, body image and awareness, keeping alert, looking after yourself from a well-being perspective. So there's a whole range of apps here that support the Year 8 community in helping them almost like build that confidence and resilience as they move into that new education kind of area for them. We also have within here an academy. So the academy, I'll click into this, contains foundation level courses on using digital apps if you've not used them for the first time. It's CPD accredited, and then it takes you through to a range of other courses that are more themed around mental health and maternity services, etc. So that is a very, very quick introduction and demonstration of both of the products. And at this point, I will just flash back into the presentation. So I'm really conscious of allowing time for questions. We also provide information around digital care pathways. We've got a whole range of these where we've taken the workflow and a pathway for a specific condition area. And we can then look at the pathway to identify the pain points that may be being kind of managed by a health system, the steps in the patient journey, and the opportunities where a health app could actually support and alleviate some of those pain points. So within this pathway, this is the depression pathway. You can see at a glance where in terms of management of patients that haven't already had access to service, that may be sitting out in the community, there's a range of apps that can support them. And then if we move across the page, the apps that can support patients if they're actually already being seen within service, but actually just help them maintain and manage their condition outside of those appointment times. And we've got a range of these in place, not just for mental health, but across things like the elective care, recovery programme, around urgent care, around community services. So we've got a whole range of these pathways. Just want to talk about specifically about the work we're doing. So I've already talked about the adult mental health campaign that's live on the library. We did until recently have a Winter Pressures campaign as well, and that campaign was there to support different cohorts of patients with respiratory management, patients that are maybe kind of prevalent around falls and frailty, mental health support and some paediatric support. So a very generalised campaign, but was there to support people kind of outside of the health services when we know from a seasonal demand it spikes significantly, although I think seasonal's all year round now, isn't it? And then the professionally supported activity, we've got the Year 8 campaign. And in progress, we've got some work in primary care, looking at how we can support primary care with adult mental health in provision of a formulary subtopic area, and then adult psychological services as well. And I suppose data and impact, let's have a look at this. So what this shows you over time is the microsite searches. So this is members of the public that are coming to the library themselves without any campaign support. We can see there's a real drive around mental health and dementia, some around diabetes as well, I think is probably the next, and nutrition. And so we can break that down in terms of the number of searches and kind of the areas there. If we look at recommendations, we've only recently started working with the formulary. We kind of, at ORCHA, we developed new products last year that were rolled out with a more kind of user-friendly version of the formulary, if I can put it that way. And we can see the impact from the school nurse campaign. So from the training at the end of December into January, we can immediately see the impact that's been created by them having that area that they can go to, which correlates when we look at the app names. The majority, the like Feeling Good Teens, Worth Warrior, Couth, Sorted, Ollie and Coggy, are all apps that are within that campaign that's been developed specifically for the school nurses in working with those Year 8 children. And then again, if we look at downloads, we kind of, Sue and I from the summer, we were trying to work up activating strategies that would really impact members of the population. And this is where you can start to see the impact of the work that's been done in adult mental health with that real focus on campaigns. So you can see like the download rate there and the correlation from the themes around those download categories and the specific apps that are involved as well. And then just in terms of summary, I just thought this was probably useful to put up. Happy to take any questions and have some discussion. But in terms of the number of sessions, the baseline position back in September, on average, we were seeing 304 sessions. And we've now increased that significantly. So with the additional work that's been done from a communication perspective, we're actually seeing a lot more people visiting the library and the impact of those campaigns being shared as well. Page views is great to see this, because what this shows us is a session is anyone visiting the library. A page view is then the time they're spending looking around the library at other pages or other kind of areas of support. And on average, we find there is around about 2.5 kind of the difference in terms of the time that people are spending then looking at other areas. So it's fantastic to see that increase. Recommendations, absolutely, with the use of the formulary and the work that we're doing directly with clinical teams, we've seen a real impact around recommendations being made through the formulary. And then obviously with the download rate continuing to increase as well with the use of specific campaigns. So I guess just in terms of finishing, really encourage you, if you've not seen it before, to use the library and have a look at it. We've got more work to do in the space of adult mental health and ideas in terms of expansion as well, but really happy to take any questions. I've not been looking at chat, unfortunately, because I've been sharing my screen, but happy to dive in there if anyone's got any questions that they'd like to ask as well. Back to you, Sue.
Thank you. Thank you very much, Alison. That was a whistle-stop tour, really, about the different functionalities of the apps library. So has anybody any questions, anything that you might want to ask Alison or myself whilst we're here? Feel free to either put your hand up, or if you're a bit shy, then type it in the chat and I will read out your question. Eddie.
I'm sort of tempted to drag Alison back into the summary data information a little bit, because I didn't quite get the full picture there, Alison, about what those numbers were representing. So, for example, the sessional increase from, I think it was around 300 to about 2,000 or something like that. Is that in total over a period of time, or is that per month? What were those figures representing?
So those figures are representing almost like a total over a period of time since we started working. But what we can see is the kind of the app library has been through quite a kind of iteration. So it started as a support specifically for dementia, and then was widened out to adult mental health. So the figures that you're seeing The baseline figures were what we took at September in terms of average use from time
average, yeah,
to what we've actually got now in January through use of those campaigns. So when we continue to monitor that on a monthly basis, but I guess what the data is demonstrating is the kind of impact of those campaigns. We've seen, you know, that push out direct to population, which we weren't able to do on the old library product. We just weren't able to show those. Is in quite a short time, it's had quite an impact in terms of the usage of app and uptake through that library.
And does that last part, does that tell us something then about how we should be utilizing the library? Like, I imagine if one goes on just as a member, you know, you just access the apps library, even though you've done your screening and assessment and all of that, it's still a bewildering choice of apps for a person to find the right app for them at that particular point in time. Whereas, you know, whether it's through the campaign or even better through the formulary, we're getting a much more targeted intervention. Absolutely. And according to your numbers, a much better take up. So, like, is that where we need to be going with this as a system, do you think?
Yes, I think so. I mean, certainly the conversations that we've had and the work we've done so far is we've got over 3,000 apps on the library. As you say, Eddie, it's quite bewildering if you go on and look at the search for the first time for a specific area. I think there are over 280 mental health apps on there. So what we're trying to do is create really carefully kind of sets of apps that can be used by clinical services. So the work with the adult psychological team at the minute, we started with a long list of crikey upwards of 100 apps, and we've got that down to probably around about 40 that they're now reviewing across that range of services. And what will happen is, at the point we're ready to go live with that service, we'll then create a subtopic folder in the formulary with just that really small range of apps for each specific patient cohort. But you're absolutely right. I think where we can do more targeted population work, that's where we really see the traction. So in another part of the country where there's a focus on diabetes, we sent a text batch campaign just across 2 or 3 GP practices to everybody that had a diagnosis of diabetes using the QOF register data. And we managed to reach 15% of that diabetic population just in a week with the product. So I think there's far more work that can be done from an e-coms perspective around really creating those targeted population messages that we can now do through the use of the library, but also, you know, thinking about the kind of real pain points for the health system in terms of challenge, whether that's waiting list, whether that's capacity, etc., and creating what we would call a portfolio of apps. So it's not always just the clinical app, but it's almost like that wraparound apps around that support well-being, etc., that we create this portfolio impact that we can then send out to the population. Does that answer the question, Eddie?
Yeah, it does. Thank you. I think it's something for us to think about. Again, I'm not suggesting that we should only go down a formulary route at all, but I'm just, you know, as a healthcare system, it's one thing saying to the population at large, these are accredited apps, you know, go knock yourself out, and a different thing, which is where we're actually trying to get some particular set of benefits from more targeted usage. I suppose the other question, that I'll shut up if I'm the only one talking, but I don't see other hands up, so I'll keep on going for a little bit.
Go ahead.
There's always a question, isn't there, about how long a user endures the app and how we go about trying to assess the benefits which might have been arrived at as a consequence of that. Is there any thoughts or pointers about how we should go about those aspects?
Yeah, absolutely. It's something that that we've been quite challenged by at ORCHA as well, because we're constantly horizon scanning across research, and most of the research has been done on individual app usage for one app, maybe across the clinical area. So there's a couple of things we're doing. We're actually introducing this year patient outcome data collection ourselves that will be automatically applied through the library. So anyone that's come into the library, whether they're interacting with a campaign or whether they're looking for something themselves, we will ask them some short questions, so we can ask them about their app usage at that point as well, as long as they consent to be involved in that process. So that's one part of it. We're also working actively with the developers. So we've got an ecosystem, obviously, of all the innovators and developers of those individual products. And we've worked this year from a technical perspective around data integration. So we're now able to work specifically with apps and their manufacturers, are the product owners of those, so that they can share their data directly back with us. So from the point of download, we can then start to understand how long that app was used for, whether it was 30 minutes, 3 days, or its continued use. So we will have more access to that data as well. That's in its early stages. We've kind of done that as part of a different focus of work on elective care, but the idea is that we will roll that out right across all of our apps around that integration. And then the third element is we are constantly looking at research opportunities that allow us to work a lot, to create a study to look at the impact of digital health. And the most recent of those we applied to Wellcome. It was with HSCNI and Ulster University as well, to look at the impact of continued use of patient-facing digital over a continued period of time. So my understanding is that applications currently, we've not heard back as yet, but we're constantly looking at how we can engage with research communities and how we can, then start to use that data. So there's a whole kind of range of things there that we're looking at. The PROMS work will go on libraries in the next month, and then the idea is that we'll roll out a phase 2 into the formulary as well, so that we can get professional feedback too.
Okay, thank you.
Anyone else? Is any questions? Vanessa was here earlier and she put something in the chat to say it's the app library is useful for in a great initiative to standardize healthcare apps. So the other thing I think I want to also add is that because we have the contract with ORCHA, we can also submit apps that we are currently using. So if there are any apps that we're currently using that we're not sure whether has been through a review process, or we're not sure what the quality assurance is like, we can ask ORCHA to first of all check whether the app has gone through the review process, and then they will be able to tell us, first of all, yes, they have, and this is what they scored, and maybe this is why they are not on the library, because if you can't find them on the library, it might be that they haven't been reviewed before, but it also could be that they have been reviewed, but they don't score as well. They don't pass the 65% threshold. So that's another useful way of us even using, to use it as a sense checking. Then in addition to that, we can also submit up to a certain number of apps for ORCHA to review. And so they will contact the developer, and then again, Alison, keep me right here, we can send them to ORCHA, and then they will then get in touch with the software developer to ask for the app to be reviewed as well. And in that case, in that sense, where we have built apps of our own previously, we have also then asked for those apps to be gone through an ORCHA review process. We've asked for the user or the trust who wanted to build the app to put into the statement of requirements that the app has to undergo an ORCHA assessment and has to meet a minimum of the 65% threshold. So in that way, we can build a certain level of quality assurance even as we procure apps to be developed, because that means then it's the onus is on the software developer to meet those minimum standards that we've asked them. Or we can, if it's a particularly sensitive app that has more personal and sensitive data, we can ask for them, for a higher threshold, perhaps in the data and privacy and security score, and impose that within our statement of requirements. So then at least then they have to meet those particular thresholds. Very conscious that a lot of apps, they're clinically orientated. We can perhaps stand over the professional and clinical assurance, but maybe less on the data privacy, usability, accessibility, because those probably are components that you would outsource to a software developer and may not be as apparent to or easily decipherable by the clinician themselves who are maybe commissioning those apps. So that's just useful to know. And then the other thing is that, and Alison didn't talk about this much, but it applies to both mobile and web apps. So if there are applications on a web platforms, those as well can be got put through an assessment process. That's why you see some of the app card, they just have a kind of a phone and they don't have a picture. It's because they're mainly web apps that actually are also being reviewed and scored, so we can also assess those as well. Do we have any other questions? I have one question, Alison. So in terms of emerging, what are the emerging areas then for ORCHA that you're seeing that how others in the rest of the UK are also using the ORCHA platform to try and get more impact? Or what are the emerging areas or with AI or things like that, what's happening in this space for yourselves?
I mean, it's quite an exciting time because we've actually got some work at the minute with the Hartree Centre, which is to look at the AI component that exists within apps, and we're building a module so that we'll also be able to assess AI within healthcare apps. So we'll be the first. That's kind of like leading work that nobody else is kind of, as far as I'm aware, doing. There's actually a workshop on Monday with a range of individuals to look at that. So from an AI perspective, it's absolutely critical that we remain above that so that we can provide that assurance around those apps. In terms of clinical areas, I guess probably the main focus at the minute is in elective care, as part of the elective care recovery work that we're seeing across the UK with the impact of waiting lists recovery, and it's taken a long time post-COVID, and the lists are growing as well in terms of seasonal pressure. So a lot of work in the space of elective care. We tend to focus on the high volume, low complexity kind of areas around elective. So very much in the space of ophthalmology, trauma and orthopedics and MSK, dermatology, cardiology and general surgery, oncology. We've got ranges of pathways and also portfolios of products that can support those particular pathways. And so that's a big piece that's going out. And again, a kind of new feature is that we'll be able to kind of align those with patient communication through patient engagement portals. So at the point that a patient is added to a waiting list, we can validate the waiting list, but at the same time we'll be able to provide apps based on their area of wait in those 5 pathways I've given, but also any comorbidities that they may have. So we've got an AI chatbot. So I don't know, as an example, if you were waiting for an MSK procedure and you were diabetic, we'd be able to provide you with not only some MSK support whilst you're waiting, but also support to support your diabetes as well at that point. So that's work in elective care. The other area is around urgent care. So we're doing a lot of work with an integrated care board in the north of England around looking at the kind of outreach community service support that's been set up to kind of keep people out of A&E. So things like the kind of like heart failure response teams, community paramedics, working with outreach teams, and again creating a portfolio of apps that can support there, and also picking up things like heart failure and pulmonary rehab, whereas patients actually may need to go back into an acute service, but again, what can we do to support them with apps? that links into the community and primary care agenda as well. So with looking at long-term condition work and primarily in the CVD space of diabetes, heart failure, hypertension, etc., creating portfolios of apps from a long-term condition perspective, where if we know, this goes back to the kind of example I gave before about diabetes, if we know we've got patients on a GP register for a specific condition, through e-coms we can actually push out an app that way. So going back to Eddie's question about, you know, kind of the relying on people to come to the library, we're doing a lot more work the other way around. We're proactively pushing out apps, but using those campaigns on the library to do it. Those are probably the main ones. Mental health is always, it remains our top search term across all kinds of client areas, and lots of work around CAMS support as well in that space, and then working with neurodiversity as well. There's a significant increase in patients that are looking for apps to support with like ADHD and autism, etc. too.
Okay, thank you. Is there any other? Oh, Eddie, you have a question?
Yeah, I'm still in the numbers game here. So, Alison, we've been at this for a few years now, and the numbers you put up on the screen earlier still seem to me to be quite low, you know, in the context of, you know, everything the health and care system is trying to achieve. How do you, when you look at what's happening in Northern Ireland and do some contrasting with other customers that you have across the UK, where would you say we are in some sort of evolutionary journey? And, you know, how would you, when you look at the take up of the apps that you see in Northern Ireland, how does that compare and contrast?
I think because the focus is purely on mental health at the minute, that as opposed to kind of have a look at the ICB that's focusing on urgent care and elective care, as an example, they're probably seeing downloads kind of like around about 1,500 consistently a month. I think that, and higher. I think that the e-coms piece really starts to change the way that apps can be delivered. I think it's probably been a slow process to date, but I think with the activation plan and the strategy that's been put in, actually tying it in to the mental health strategy is a significant kind of opportunity. I feel that actually in some other areas of the country they've not kind of done that yet. I think where it's aligned to strategy and the pain points that you're trying to achieve, then that's where you start to make the difference. So because you actually then get the kind of the drive and the leadership and the clinical teams coming together, and I think that's happened through the mental health strategy work this year with Sue and Fiona. So prior to that, I think there's been pushes in terms of trying to push it out, but it's sometimes difficult to find the clinical teams, and I think there's a more direct route to that now. Certainly in the work that we're doing in urgent care and elective care, then that is the mission for the ICB. They've got to do that to achieve kind of like the performance and break even, etc. So that drive is there, and I think that started to happen through the mental health policy work this year. But I also think
the digital mental health action plan is still being finalized. So I hope we have got the apps library clearly referenced in that plan, but it's still not published yet. So hopefully when it does get published, then it will obviously again reference things that we could be doing better. Certainly within the actual action plan. That hasn't been published yet, so it's been nearly a year and a bit. We're still waiting for that to be finalized and published.
I think one of the areas that could really gain traction, as we've seen in other areas, is around that elective care space, because, you know, I've kind of seen the waiting times that have been published. I think there is an opportunity. We've seen that in other areas where we're able to give people apps that support them while they're waiting. They're no longer waiting in a vacuum. They've got something there as a level of support. And I think that is potentially an opportunity that could be looked at as well.
And I think more comms, I think more targeted comms. At the moment,
Yeah.
there are a lot more signposting. So we have, for example, in the our apps library as reference within the Minding Your Head side, but it's just a link. So you need, you know, just having it as a link means people are still coming across it rather than being targeted. And I think we just need to do a lot more thinking about the activation strategy and how we marry that with our communication and engagement to try and position this a lot better. So maybe, you know, even having it out as part of, I mean, I had a meeting with an A&E consultant a couple of days ago, and he wasn't aware that the site exists, even though all the trust comms have been communicated to about the existence of the library. It just hasn't filtered down to the individual directorate. So he had something he wanted to develop. He found this really useful, but he had not come across. Nobody had told him. And we've had the library for a number of years now. Yeah. So it's the comms is still very much needed.
I think the comms and those using those e-comms links, I think similarly with the Winter Pressures campaign, that I know, you know, so we'd spoken to trust boards, etc., and you can give people the information. It's then what's being, how that's then being kind of put into operations. And I think that for the Winter Pressures work, that, you know, even though we'd started that work earlier, you're still always catching up there. But I think there is something about how we get this, you know, because we've got the links there for the URLs there. It could go into any patient communication across the piece to support them in, you know, looking for an app through the library site. But it's then where we've got those campaigns that we can really target those populations, because that's where we see the take up when we're able to do that. But that does require then, it can't be a one-off campaign. It requires a social media message, etc., on a regular basis.
Thanks, Eddie. Any other question from anyone? Okay, if not, then please, first, then thank you very much, all of you, for taking out time to come and attend this session. Again, much thanks to Alison for the presentation. Hopefully in a few weeks' time, the video will be uploaded onto YouTube, and we will hopefully be able to share the links with yourselves for any further sharing with colleagues. Okay, thank you.
Thanks all.